My name is Maeturah Harmon. I'm a doctor of osteopathy, so that's a DO. I work at Four Sanders Women's Specialist, and I am accepting new patients. I'm from Texas. I moved here in 2022. I've said that Knoxville has been a pleasant surprise. It's been really nice to be here. I have 3 kids, and I had 3 C-sections, and that's always kind of a surprising thing for patients. But I tell them I grieve with them about that inability to have a vaginal delivery, because mine was obligatory because I had fibroids, pretty large fibroids, for which I had a robotic myomectomy. So I think sometimes we feel like doctors are inhuman. You know, we're just kind of in the trenches right along with you guys. And I have had a lot of the same diagnoses as many of my patients: endometriosis, fibroids, heavy bleeding, pelvic pain. So I can really kind of sympathize and empathize with what my patients are experiencing. So why did I choose obstetrics and gynecology? Honestly, that was not my first choice. I thought that I was going to go into med peds, which is internal medicine and pediatrics. I like to say that medicine kind of chose me, and my parents will tell you that I have always wanted to be a doctor. Since I was little, I had that dollar store doctor kit that I was putting Band-Aids and listening on with the stethoscope to everything: animals, doll babies, guests, my parents. And so I think that area of career kind of just chose me. And my journey through medicine, you know, I went to undergrad, I actually got a master's, then I went to medical school. And in medical school, that's where I learned that obstetrics and gynecology was my passion. I didn't think surgery was my thing, because I think blood and guts kind of, you know, give me the heebie-jeebies. But whenever I did my surgical rotation, particularly in OB, I found myself not really looking towards the baby that was delivered, but was really engaged in the surgery that I was participating in. And so from there, my interest just kind of flourished and blossomed, and it took me away from the pediatric aspect and more so into surgery. And so one thing that made me a little bit nervous about going into obstetrics and gynecology, that it's just solely women. And I thought I would be limiting my medical training through medical school because I'm just taking care of women. But the truth is, in obstetrics and gynecology, it really is about preventative care through the whole spectrum of a woman's life. And we do a lot of medicine: hypertension, diabetes, thyroid disease. We're making sure that women stay healthy, you know, from adolescence all the way through menopause. And so once I got into my training and, you know, just got further and further into my career, I have found that it's very, very fulfilling, not just the gynecological aspect of it, how we're able to take care of women through the full spectrum of their life, but also the reward that you get every time you deliver a baby and bring new life into the world. So obstetrics and gynecology, I think, was something that was kind of chosen for me, or I chose, even though medicine was chosen for me. One piece of advice that I often give to my patients is that this is your health and we are just here to help. And so I always encourage patients to have autonomy. Just ask as many questions as you can, because I think knowledge is power. And so I guess really charge to the patient is just to ask as many questions as possible, because I think the more educated you are about your condition, the better you can feel, you can recover, and you just have a knowledge of what's going on within your body. Outside of work, I have a great passion in traveling. And I mentioned that I have 3 young kids currently. And so you would think that traveling has been something that has slowed down, but we have really been passionate about continuing to travel and exposing our kids to the world. And so surprisingly, my 3-year-old and my 2-year-old already have global entry. So we are just traveling and exploring the world here and abroad. Again, I'm not from Tennessee, but we have found that there is so much here in Knoxville with regards to the trails and hiking and just going up the hill to Pigeon Forge and Sevierville. So traveling really is my passion. My family's also West African, so food is a big thing for us, and exploring culture. So My family is very important to me, and music and dancing is also something that we love. And so, like when the boys come home from school, we have our little dance parties. Right now, our favorite song is Ooh, Ee, Ooh, Ah, Ah, Ting, Tang, Walla, Walla, Bang, Bang. And so it's just so cute, just having that quality time and seeing them grow up. But really right now, that's like my whole focus, just being a mom and being a parent and just kind of watching these kids grow up.